Imagine your body as a busy city. Your blood vessels are the roads and blood is the traffic. High blood pressure silently wears down these roads, often with no warning signs. That's why regular checkups matter. Knowing your numbers gives you the power to protect your health. When you hear you have high blood pressure, your first thought might be about medication. And while medicine is incredibly important and life-saving for many people, it's not the only tool in our toolbox. One of the most effective and natural ways to lower your blood pressure is something you already know how to do. Move your body. Exercise is powerful medicine. It doesn't come in a pill bottle, but its effects on your heart and blood vessels can be just as profound. It's a solution that empowers you to take an active role in managing your own health and wellness journey. So how does moving your body help? When you exercise, your heart starts to pump faster and harder to get more oxygen-rich blood to your muscles. This might sound like it would raise your blood pressure, and it does, but only for a short time while you are active. The real magic happens over the long term. Regular physical activity makes your heart stronger. A stronger heart can pump more blood with less effort. If your heart doesn't have to work as hard to pump, the force on your arteries decreases, which naturally lowers your blood pressure. Think about it this way. Exercise is like a workout for your heart and your blood vessels. It makes them more flexible and efficient. Regular activity helps your arteries relax and widen more easily, which allows blood to flow through with less force. It's like turning a narrow, bumpy country lane into a wide, smooth highway for your blood to travel on. This effect doesn't just happen overnight, it comes from making movement a consistent part of your life, day after day. The benefits build up over time, creating a healthier internal environment. In this guide, we are going to explore exactly how you can use the power of movement to your advantage. We will break down the science in simple terms so you understand what's happening inside your body. We'll show you easy, practical exercises that anyone can do, no matter your fitness level. And most importantly, we'll give you the tools and motivation you need to get started and stick with it. You don't need a gym membership or fancy equipment. You just need a willingness to take that first step toward a healthier, more active life. High blood pressure forces your heart to work in overdrive every single second of every day. The heart's main chamber thickens, becoming less efficient and struggling to relax. High blood pressure acts like a sandblaster, damaging artery walls and leading to dangerous buildup. Over time, this strain can cause heart disease, heart failure, or even a heart attack. That's why it's vital not to ignore the pressure building up within our bodies. High blood pressure doesn't just harm your heart, it can damage your brain and kidneys too. It raises your risk of stroke and vascular dementia by damaging blood vessels in the brain. And it can cause kidney failure by harming the tiny vessels that filter your blood. Controlling your blood pressure protects your brain and kidneys for the long term. The dangers of high blood pressure even extend to your eyesight. Your eyes are filled with tiny, fragile blood vessels that supply blood to the retina, the light-sensitive tissue at the back of your eye. The retina is what converts the light you see into signals for your brain to interpret. Just like the other delicate vessels in your body, these are highly susceptible to damage from high pressure. This condition is called hypertensive retinopathy. The sustained force can cause the vessel walls to thicken, narrowing the passage for blood flow, or it can cause them to leak blood or fluid into the retina. In the early stages, hypertensive retinopathy might not cause any symptoms. As it progresses, however, you might start to experience blurred vision, double vision, or sudden vision loss. The damage can also lead to a more serious problem called optic neuropathy, where the blood flow to your optic nerve is blocked. The optic nerve is the critical cable that connects your eye to your brain, and damage to it can cause permanent blindness. Keeping your blood pressure in a healthy range is one of the most important things you can do to protect your precious sense of sight for your entire life. Beyond these specific organ systems, high blood pressure can also contribute to a host of other health problems that affect your quality of life. For example, it is a major risk factor for peripheral artery disease, or PAD. This is when the arteries that supply blood to your limbs, usually your legs, become narrowed by plaque. PAD can cause pain, cramping, and numbness in your legs, especially when you walk. In severe cases, it can lead to dangerous infections and even amputation. High blood pressure can also contribute to bone loss or osteoporosis, increasing your risk of fractures. Finally, high blood pressure can also interfere with your sexual health. For men, consistent blood flow is essential for achieving and maintaining an erection. The damage to arteries caused by hypertension can reduce blood flow to the penis, making erectile dysfunction a common complication. For women, reduced blood flow to the vagina can lead to lower libido, vaginal dryness, and difficulty reaching orgasm. These issues can be deeply personal and stressful, but they are a very real physical consequence of the damage hypertension inflicts on your circulatory system. When you exercise, walking, biking, or swimming, your heart pumps faster and your blood vessels widen to deliver more oxygen. This natural process called vasodilation helps lower your blood pressure after each workout. Over time, regular exercise trains your vessels to be more flexible, supporting a healthier heart and lower blood pressure. While the immediate effects of exercise on your blood vessels are great, the true magic happens when you make physical activity a consistent part of your life. Over weeks and months of regular workouts, your heart muscle adapts in a remarkable way. Just like lifting weights makes your bicep muscle stronger, aerobic exercise makes your heart stronger. But unlike the unhealthy thickening caused by high blood pressure, this is a healthy positive adaptation. A heart that is strengthened by exercise becomes a more powerful and efficient pump. It can push out more blood with each and every beat. Think about it this way. An untrained heart might have to beat 80 times a minute to supply the body with the blood it needs while at rest. A heart that has been strengthened through regular exercise might only need to beat 60 times a minute to pump the same amount of blood. This is because each individual beat is more effective. This lower resting heart rate is a classic sign of a healthy, fit cardiovascular system. It means your heart isn't working as hard during your day-to-day life, whether you're sitting at a desk, cooking dinner, or sleeping. This increased efficiency has a direct and profound impact on your blood pressure. Remember, blood pressure is the force of the blood pushing against your artery walls. When your heart can pump blood more effectively with less effort, the force exerted on those arteries naturally decreases. The strain on your entire circulatory system is reduced. A stronger, more efficient heart doesn't have to slam the blood into the arteries. It can push it through with a smooth, powerful, and less forceful rhythm. This is the central mechanism through which long-term exercise helps to lower and control high blood pressure. This change doesn't happen overnight. It is the result of consistency. By engaging in regular aerobic exercise, like walking, jogging, cycling, or swimming, you are continuously conditioning your heart to perform better. Over time, this leads to a durable reduction in your resting blood pressure. Many people who stick with an exercise program can see a significant drop in their systolic and diastolic numbers, often enough to reduce their need for medication or even stop it entirely with their doctor's approval. It's a powerful, long-lasting change that you earn through your own effort. Exercise lowers stress and relaxes arteries by burning off stress hormones and boosting endorphins, your body's natural mood elevators. This helps keep blood pressure stable and your body resilient to daily challenges. Plus, exercise improves insulin sensitivity, further supporting a healthy heart and blood pressure. There's a direct link between body weight and blood pressure. Carrying extra weight makes your heart work harder, raising pressure. Exercise helps you lose weight, which can lower your blood pressure and reduce heart strain. Even small weight loss makes a big difference for your heart and health. Your first step to better health is simple. Just start walking. Walking is free, easy on your joints, and perfect for all ages. Walk briskly as if you're late for an appointment and aim for consistency. Make it a daily habit, invite a friend, and enjoy the journey to better health. Walking is a great start, but adding variety keeps you motivated and benefits your body in new ways. Try cycling for a gentle, heart-healthy workout, or swimming for full-body exercise with no joint stress. Activities like Tai Chi or yoga blend movement and mindfulness, improving balance and reducing stress. Find activities you enjoy. Anything that gets you moving can help lower blood pressure. How much exercise is enough? The American Heart Association recommends at least 150 minutes of moderate activity per week, just 30 minutes a day, 5 days a week. You can break it up into shorter sessions, and any movement counts. Consistency matters most. Start small, build up, and celebrate every step. Aerobic exercise gets all the attention, but strength training is just as vital for heart health. Building muscle boosts your metabolism, helping you burn more calories, even at rest. More muscle means easier weight management, which directly benefits your blood pressure. Strength training also improves blood vessel function and insulin sensitivity, both crucial for heart health. You don't need fancy equipment. Body weight moves like squats, lunges, and wall push-ups work wonders. Aim for strength training at least twice a week on non-consecutive days. Focus on good form and start with a resistance level that lets you do 8-12 reps with effort. Remember to breathe throughout each exercise. Never hold your breath. Combine strength training with aerobic activity for the best results. This balanced approach is your recipe for a stronger heart and lower blood pressure. The hardest part of starting an exercise routine is often just getting started. Forget about big goals for now. Just move for 5 minutes today. Walk around the block, stretch, or march in place during a TV break. The activity doesn't matter. What matters is starting. Small wins build momentum and make new habits stick. Ditch the all-or-nothing mindset. Every minute of movement counts. On busy days, even a short walk is a victory. Consistency beats perfection. So take action now. Stand up and move for 5 minutes. Don't overthink it. Just do it. Notice how you feel after moving. This simple act is proof you're taking control. Your journey to lower blood pressure starts with this first step. To make exercise stick, treat it like any important appointment. Schedule your workouts in advance. Write them in your calendar or set reminders on your phone. Be specific. Decide when, where, and what you'll do. Prepare ahead. Lay out clothes or pack your gym bag the night before. Remove small barriers so it's easy to get started. Life happens, so always have a backup plan. If you can't walk outside, try an indoor workout or march in place. Flexibility keeps your streak alive no matter what. Prioritize movement as a non-negotiable part of your week. Planning ahead turns intention into action. Motivation comes and goes, so build systems that keep you moving. Track your workouts. Seeing your progress is a huge motivator. Celebrate small wins like walking farther or lifting more. Find support. Exercise with a friend, join a group, or connect online. Accountability and camaraderie make it easier to stick with your routine. On tough days, remember your deeper reasons for exercising. Maybe it's playing with grandkids, traveling, or staying independent. Connect your habit to your why. Visualize the healthy, active life you're building. Progress isn't about perfection. It's about showing up one step at a time. Keep your vision clear and your support strong. That's how you make exercise a lifelong habit. You now understand the risks of high blood pressure and the power you have to change your future. Exercise isn't just a quick fix. It's a lasting transformation for your heart and body. You don't need to be an athlete. Just start with simple steps like walking. Find activities you enjoy and mix in strength training for the best results. The perfect plan is the one you'll stick with. Start small, schedule your workouts, and use your support system. Track your progress and celebrate every win. You have the knowledge and tools. Now it's time to act. Your healthier life is within reach. Take the first step today. This guide is your map, but you must take the journey. Progress is about persistence, not perfection. Celebrate every effort, even a 10-minute walk. Each step is an investment in your future health and happiness. Don't wait for the perfect time. The time is now. Stand up, move, and feel the power of action. You're not just lowering a number, you're building a better life. Your body can grow stronger at any age. Embrace movement and take control of your story. I believe in your ability to succeed. Start today and keep going tomorrow. Your vibrant, healthy life is waiting. Go get it.